Hi everybody, welcome to Healthline. I am Gregory Zarian. So it is November, and the month of November is known as Movember. The entire conversation this month is all about you men and your health. I feel men don't talk about their health as much as women do, so this month has been designed internationally for you, me, and us guys to talk about what we need to know to lead a healthier lifestyle, to stay healthy, what to look for, what not to look for. So I decided to bring you a new member of Adventist Health Glendale, Dr. Andrew Nguyen. He's a urologist specialist, and the conversation today is all about prostate health. How are you, doctor?
I'm fine. How are you doing, Greg?
I'm good, thank you. Welcome to Adventist Health Glendale.
Thank you very much. It's a pleasure to be part of this community, and it's a pleasure to be here today.
Movember, it's a big conversation about men and their health. Why do you think men don't talk about their health as much as women?
As you know, in women, they are more aware because of the active participation about breast cancer, about GYN issues such as incontinence. In us men, we kind of think we're kind of the tough guy, as you know. And,
we are.
We don't talk about these things. I mean, I go home, I don't talk to my family about, my medical issue, but, my sister, other relatives, like my female cousin will come home and they'll ask me, oh,
what do you think about this? What do you think about that?
What do you think about that? Exactly.
Do you think it's pride? Do you think it's shame? Do you think it's, I'm a man, I can't talk about it?
I think it's more pride and something like an ego for us.
Love that ego. Okay, so guys, for this entire half an hour, please check your ego at the door. But also, a lot of men then, because of their lack of conversation, end up having prostate cancer. We talked earlier, colon cancer. Out of every new 100 diagnosis of breast cancer, 1 to 3 are men. So what do you say to the male community that's watching now? How do you invite them to talk more about their health?
I think the most important thing is to be proactive.
Love that.
We need to see our physician more regularly. We need to be bringing our medical, I wouldn't say problem, but some of our medical symptom as part of our conversation that we can talk to family members. As you know, we're not going to sit at a bar with our buddies and talk about prostate issue. That's just something.
But what's fascinating is women will go to that same bar and talk about breast cancer awareness, prevention. They will talk about what the girls are doing. So for this episode, we invite you to open up to having a conversation with your friends and your family. When we come back, we're going to talk about what BPH is. We're going to talk about prostate health. We're going to talk about is that how you say it?
Prostatitis.
Prostatitis. We're going to share with you what you need to know, signs and symptoms. And do you know what a UTI is? When we come back, I'll tell you all about it. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Happy Movember, men. It's all about you and the conversation about you, me, and our health. The conversation today is about prostate health. Joining us from Adventist Glendale is Dr. Andrew Nguyen. His specialty is urologist. You are new to Adventist Health Glendale. What is some of your, what is your medical history, doctor?
Well, I was at Tulane in the Deep South, as you know, for my residency. And afterwards, I did a fellowship in reconstruction in both male and female. Okay. Focusing on incontinence as well as patient with voiding dysfunction. Okay. And also patient with spinal cord injury or neurourology. So, as we were discussing earlier in the beginning, a lot of men don't talk about it, and so it's what you talk about every day. Tell us, doctor, about the prostate. Just the function of the prostate. Let's start there. Well, that's a very interesting question that you just asked, because I've been asked that day in and day out. The prostate, as you know, is an organ that sits between the bladder and the tube that brings the urine out, called a urethra. Now, what is the role of that organ? We really don't know. All we know is that it does give secretion, contributing part to the semen.
Okay.
And just like the appendix, the only thing that it probably causes a lot of problem is urinary issue in men as we get older.
Okay.
So basically, at this time, is what we call a nuisance organ. As you can say that.
However, we need the nuisance organ. We need the nuisance organ for quite a few things.
Yes, besides producing part of the semen for semen's health, I think at this point there's not really a big role in what is the role of the prostate for.
When we talk about the prostate, it is prostate cancer is the second leading cause of death in men.
Correct.
First, heart disease. Let's just start out of the gate in regards to, because today it's about the BPH, the benign prostate hyperplasia. What is that?
Well, BPH or benign prostatic hyperplasia is really a medical term of what we find when we take samples from the prostate. It's a pathological diagnosis. As we get older, some of these components will start to grow.
When you say older, what are we saying age-wise?
At about age 40.
Okay, so from age 40.
Yeah, from age 40 on, our prostate will start growing.
It gets enlarged.
It gets enlarged,
Okay.
which then the terms become prostatic hypertrophy or enlargement of the prostate. At about the age of 60, we know that 60% of men will have this problem.
Okay.
And at the age of 80%. So we make it very simple. The symptoms...
So 40, 60, 80.
40, 60, correct. And as we get older, at about the age of 60, we know that about 40 to 50% of men will start to have some urinary tract symptoms as a result of the prostate getting bigger, and when it starts to causing obstruction, and we call it benign hypertrophic obstruction, or BPO.
BPO. But benign means it's not cancerous.
Yes.
And it's very different than, of course, prostate cancer.
Two totally different diseases,
totally different.
But the symptoms can be very similar.
Okay, so what is the distinction, first of all, in regards to prostate cancer? What are signs and symptoms that men should look for?
Well, most of the time, prostate cancer is a silent killer. That's how I usually tell my patient.
Which is awful.
Yes. Most of the time, men come in to see me without a lot of symptoms. The way to diagnose prostate cancer is by two things. Number one is a digital rectal examination, and number two, most men are found to have prostate cancer also due to an abnormal level of PSA,
Okay.
which is prostatic specific antigen. It's very specific, produced by the prostate. From the examination and from our PSA, it could lead to us doing an ultrasound guided biopsy. And from the biopsies, that's how we determine men to have prostate cancer.
Since it's a silent killer, when do you recommend men to go in and get their prostate checked? First of all, first and foremost, always check your family history. You know, is prostate cancer and prostate issues, is it hereditary?
Yes.
Okay.
In men, yes, prostate cancer is hereditary.
Okay, great.
So usually in patients who have a high risk of prostate cancer, for example, men who have a family history of prostate cancer, or an African American male,
Okay.
we usually recommend that they come in to see their physician and get a PSA as well as a prostate examination every year.
From what age?
At about age 40.
Okay, so for age 40.
Yes, for high-risk men.
For high-risk men, what if you're not high risk?
If you're not high risk, then it's about age of 50.
Okay, so from the age of 40, so as a male, you do not need to have your prostate checked before the age of 40, but if you're high risk.
Correct.
And then for other men that are not high risk, hereditary.
Or African American.
Or African American from the age of 50.
Correct.
Great, more Dr. Nguyen when we come back. Don't go away. Welcome back. The entire conversation is all about prostate health. Joining us from Adventist Health is Dr. Andrew Nguyen. His specialty is urology. Doctor, since we just addressed signs and symptoms, prostate cancer, and if you are high risk and you're an African male from the age of 40 to get your prostate checked, and if there are no signs and symptoms or any signs of prostate cancer in your family, no hereditary at the age of 50.
Correct.
Then what is the distinction between signs and symptoms with BPH and prostate cancer?
Sometimes there isn't really a lot of distinction.
Okay.
But men with BPH will usually present with either what we call voiding irritative symptoms, which is waking up a lot to go to the bathroom at night, going to the bathroom frequently, a strong desire to go every time, and also they also present with what we call outlet obstructive symptoms,
Okay.
which is slow stream,
Okay.
having to push or strain, also having to double void, meaning that once you urinate, you have to urinate again to try to empty the bladder, or sometimes what we call is an intermittent stream, where the stream kind of sputter.
Okay.
So those are the usually symptoms of men with what we call enlargement of the prostate.
In regards to a man having a normal stream of urination, what is considered a normal stream? When you were saying sputtered, stop and start, what should we look for to know that everything is okay?
Well, usually, from a scientific or medical point of view,
Sure.
we have to do certain tests to determine what is a normal stream. But men usually they can gauge by their symptoms.
Okay.
If they notice that their stream is weak,
Okay.
such that there's no power behind it, what
Okay.
I usually ask my patient, or if they notice that the stream kind of dribble or sputter, like I said
Okay.
to you, it cuts off, and you have to go intermittently.
Okay.
And usually that's a symptom. There's an obstructive component
Okay.
to it. And then for the voiding irritative symptom, it could be from the fact that they're not emptying their bladder.
Okay. And here's the thing, though, too, men, is that if you have noticed anything of what the doctor said, don't panic, don't Google, don't self-diagnose. Pick up the phone and call Dr. Nguyen or your urologist and say, hey, these are some of the signs and symptoms.
Yes.
What else do men need to look for in regards to signs and symptoms with BPH, or is that pretty much it?
That's pretty much some of the most classic signs and symptoms. Of course, we can go more into details in terms of more severe symptoms, just as blood in the urine,
Okay.
Due to the enlargement of the prostate, or bladder stone, which is due to the fact that the urine is not completely empty,
Okay.
and they crystallize
Okay.
in the bladder, forming stones. So those are more serious signs and symptoms that definitely need to be addressed.
Well, the blood in the urine could lead to bladder cancer.
Correct.
As I've said here on the show before, my older brother suffered from bladder cancer. What are signs and symptoms of bladder cancer outside of blood in the urine?
Usually it comes from, as you know, the most common cause is smoking. Yes.
And working in an auto body shop.
Yeah. Patients usually present with frequency, meaning going to the bathroom frequently, some burning or urgency.
Okay.
And of course, what we call blood in the urine under the microscope.
Okay.
And then from there, the history will give us some indication of whether or not we need to do a workup.
Okay.
For example, if a patient is high risk, such as age, older patients, patients who is a smoker, patients who works with chemical, those are usually the high risk patients.
If someone comes into your office and is diagnosed with BPH, what is the treatment behind that then?
Well, there are several treatments, and it also depends on their severity
severity
and
of
how
it.
much it affects their quality of life.
Got it.
Usually, as you know, we start out with a very basic physical examination, basic tests such as a urine, PSA that we talk about, and then we can progress on to more specific studies. But usually we will start patient off with medication.
Okay.
And see how they're doing, and some modification of their lifestyle, such as number one, kind of decrease your fluid intake, avoid taking anything that can irritate the bladder, such as caffeine.
Okay.
So those are very simple modifications that we can make in addition to medication.
So then, doctor, I go to get a prostate exam every year. My father had prostate cancer, and with my older brother's bladder cancer diagnosis, I just want to make sure that all is well. Is my BPH checked every year? Is everything, when you were saying a PSA, all of that is standard to be checked?
Yes.
For, say, for me or someone that has
Well, you have a very high risk
history of it.
history because
Okay.
your brother has bladder cancer and your father has prostate cancer. So I would definitely recommend that you get a yearly physical examination along with a prostate check as well and a PSA.
And that's for anybody that has, even without the history, it's important for men to come in to see a urologist. Again, high risk after the age of 40, and then with no risk the age of 50. In regards to keeping your prostate healthy, what is the first thing that comes to mind?
Well, there are certain behavioral changes. Number one is to exercise. Okay, because obesity has been known to cause enlargement of the prostate. Number two is eat a healthy diet, which is a low protein, and to cut down your fat. Number three, there are certain vitamins, even though, for example, saw palmetto is a vitamin that's been very important, that's been shown to decrease the symptoms. There are pretty much not a lot of studies in the United States that show the effectiveness of saw palmetto, but in the European studies, it does show effectiveness in decreasing symptoms.
So saw palmetto. And also lycopene.
Lycopene actually has been shown before in the past, but when they did studies, it has not been shown to improve the health of the prostate.
Oh, really?
Yes.
But if you love a good tomato, have a tomato more. Dr. Nguyen, when we come back, don't go away. Welcome back to Healthline. Adventist Health Glendale has been recognized by U.S. News and World Report as one of the best hospitals of 2018-2019, ranking 15 out of 133 hospitals in Los Angeles and 28 out of the 414 hospitals right here in California. Adventist Health Glendale recently received its 10th A grade in a row for patient safety from the Leapfrog Group. Congratulations, Adventist Health Glendale. And speaking of Adventist Health Glendale, joining us is urologist Dr. Andrew Nguyen. Doctor, we were talking about with BPH, you can give medication. There's some treatments you can give to cure it. So it can be completely cured, yes?
BPH cannot be cured.
So it can be healed.
The symptoms can be ameliorated,
Okay.
or we can reduce the progression with medication.
Okay. What if medication doesn't work?
Well, as you know, back in the old days, even before I became a urologist, the old treatment used to be called a TURP, or transurethral resection of the prostate, and how I like to word it to my patient, as we used to say in the South, called a roto-rooter job.
I want to cross my legs. Okay.
And that the surgery really, number one, is beneficial, but the other aspect of the surgery, it can cause some side effect, such as erectile dysfunction.
Got it.
And retrograde ejaculation.
Okay.
Nowadays, we have a few varieties of minimally invasive treatment, such as the UroLift, which we use a device to compress the prostate, that basically opening up the channel and allowing the prostate to have a wider opening such that the patient can urinate with the minimal side effect. In fact, studies have shown that it does not cause or very low incidence of retrograde ejaculation or sexual dysfunction. The other treatment could be using water vapor therapy as the second. And of course, the third treatment could be what we used to call a microwave treatment. So, I think with these modalities, we have a lot of things to work with. And, thank God I'm able to do these things, which improve the lives of my patient as well as improve their quality of life.
Well, I'm saying thank God to you right now. Thank you for that. In regards to other prostate maladies with men, Urinary tract infection. What are signs and symptoms of that?
Well, it depends. If patients, as they get older, some men are prone to what we call prostatitis.
Okay.
And there are two types. There's acute prostatitis, which is a very severe infection, urinary tract infection of the prostate.
Which is also known as a UTI.
Yeah, where they can have fever, very high fever with chills, and real severe irritative symptoms, just as burning, going to the bathroom frequently, and also in some men, blood in urine, as well as what we call urinary obstruction, where they cannot urinate, requiring a catheter replaced to drain their bladder.
Got it. Signs in regards to a UTI, how does a man take care of urinary tract infection?
Well, number one, they need to go see, obviously, their doctor, because they need to be on antibiotics to get rid of the infection. They also need to do common things such as cyst bath. Drink plenty of fluid.
When you say fluid, are you just talking waters, teas?
Yes, that's usually. And then in other men, we can put them on like cranberry extract, which can acidify the urine and reduce the infection as well.
Do you recommend men drink cranberry extract on occasion just because?
Yeah, I mean, I don't have any problem with that, but usually fluids is the most important thing.
And when we say fluids, we're not saying alcohol or beer?
No alcohol, because that can irritate your bladder and the prostate.
Can men drink too much water?
The answer to that
and or women?
The answer to that is that, there's really no magical number. I mean, I know that a lot of my patients come to see me and they tell me, Dr. Nguyen, I've been told I have to drink 8 glasses of water. That depends on the patient and their medical history, and also depends on their career. For example, if you're prone to having kidney stone, of course you have to drink a lot more fluid.
Yes.
But if you're having problem with loss of urine, such as incontinence, you may want to regulate the amount of fluid that you drink, such that you don't have to go to the bathroom so much.
But one thing people also have to realize as well is that the lack of drinking water can contribute to headaches, which means your body is dehydrated. And a lot of that then goes back to your doctor, telling them what you feel, your signs and symptoms of everything and anything. Doctor, because I don't have a lot of time left, what are your final thoughts in regards to men and their prostate health one more time?
I think the most important thing is, number one, they can change their lifestyle, which is exercise, decrease a fatty diet, lose weight, and then, of course, to see your doctor regularly for a yearly physical examination, which should include a prostate examination and a PSA.
Doctor, on behalf of men everywhere, I'm saying thank you very much for having the conversation about me and men and our health. Will you come back next year so we can talk more about incontinence?
Yes, certainly. I will be very happy to be back. And again, thank you very much for allowing me the opportunity to talk about something that's very dear to my heart, which is men's health.
Thank you for that. Thank you for all of it. So you heard it from Dr. Nguyen. First and foremost, talk about it, guys. Guys, talk about it to your dad, to your uncle, to your friends, to your brothers. There's nothing to be ashamed of. If you are urinating frequently, if you find blood in your urine, if you are having erectile problems, difficulties, it's a conversation that will possibly and most likely save your life. That is why we are here at Healthline, to give you as much information as we can, as I can, so that you have it, so that you know it, so that you pass it on, because that one little bit of information can change your life. Remember, the most important conversation you are going to have is about you and your health, so why not have it right now? And thank you for following us and being part of our conversation. You can always find us on social media, Facebook at AH Glendale, LinkedIn, Adventist Health, and you can always visit the website, AdventistHealthGlendale.org, and you can always find me at Gregory Zarian. Take care. Men, keep your November going. We'll see you next time. Have a great day.